Good morning, everyone. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today, I wanted to explain more about contraception method. And this is part 2, and you should see part 1, which was done before. So, what we wanted to cover today in this lecture, the best contraceptive choice for women and how to choose, types of intrauterine device, classification of IUD, the copper-releasing intrauterine device, the hormone-releasing intrauterine device, sterilization method, barrier method of birth control, and lastly, natural birth control. Let's start our journey. The best contraceptive choice for women can be done by knowing the personal characteristics and the reproductive history and doing physical assessment and use the chart proposed by the WHO and CDC, which include many patient characteristics and risk factors like age, like smoking, like thromboembolism, like cardiac disease, hypertension, diabetes, thyroid dysfunction, any other risk factors, and then categorize your patient according to the method used into one of the 4 categories. Category 1 and 2 is safe. Category 3, there is complication with its use, and the category 4 shouldn't completely use because it is hazardous. So let's start with intrauterine device. Intrauterine contraception is the most commonly used method of long-acting reversible contraception because of its high efficacy and safety, ease of use, and low cost. The types of intrauterine device, we have first generation, second generation, and third generation. First generation first started by the Libis group, which is double S shape and safety coil, and the other types. It was formed of inert material and they cannot release any active substance. With advancement of intrauterine device, the second generation appeared in 1988, which is copper T, like this one in the picture, and all other copper releasing IUD. Then later on, recently, third generation developed, which is levonorgestrel releasing intrauterine system, as you see here in this picture. This picture shows you some of the intrauterine device like Libis loop, safety coil, copper T, copper 7, Nova T, multi-load, levonorgestrel releasing intrauterine system, frameless copper intrauterine device. What is the classification of IUD? Generally, we can classify them into either copper containing IUD or levonorgestrel releasing IUD. And this is all over the world, used in USA and in Egypt and different countries all over the world. The levonorgestrel releasing IUD containing a total of either 13.5 milligram or 52 milligram levonorgestrel. In this picture, different types of copper IUD. This is a multi-load, this is the Nova T, this is a copper T, and this is a Monlisa copper IUD, and this is a frameless copper IUD, and this is the Marina or levonorgestrel releasing IUD. What about the copper releasing IUD? As you see in this picture, this is a copper releasing IUD, and you can see the copper on the vertical stem and the transverse stem here. The copper releasing IUD is a T-shaped polyethylene device with 380 square millimeter of exposed surface area of copper on its arm and stem. Barium sulfate has been added to the polyethylene substrate to make the device ready-obey. A 3 millimeter plastic pool, can you see it here, is located at the base of IUD through which the monofilament threads pass. The monofilament threads attached to this port, this one, monofilament to prevent infection. If multifilament, liable for more infection, but monofilament is less liable for infection or ascending organism. And this is the insertion tube, and this is the flange, and this is the plunger of the system of insertion, and this is the copper T, as you see. The hormone releasing IUD, or for example Mirena, as you see in the picture, is a radiopaque T-shaped device with 52 milligram of levonorgestrel on its arms and stem. The progestin is released at rate of 20 microgram per day. And as you see, this is a Mirena system or levonorgestrel releasing intrauterine system. This is a T-shaped IUD, and this is the flange, and this is the insertion tube, and this is the slider, and this is the handle and the threads inside, and this is the insertion tube with calibration in centimeter. What about the mechanism of action and duration of use? As regards the copper releasing IUD, it is used for 10 years. The released copper ions interfere with the sperm mobility and incite a foreign body reaction that result in a spermicidal environment. And this is the main mechanism of action. While the hormone releasing IUD, levonorgestrel, is thought to thicken cervical mucus, creating a barrier to sperm penetration through a cervix, and it may stop ovulation and thin the uterus lining. And it can be used up to 5 years. This is a picture how it looks, the hormone releasing IUD, and this is a picture of copper releasing IUD. The timing of insertion as regards the copper T380 IUD may be placed at any time during the menstrual cycle as long as the patient is not pregnant. And so many prefer to insert it on the 5th day of the menstrual cycle. The 14 and the 20 microgram levonorgestrel releasing intrauterine devices are inserted during the first 7 days of the menstrual cycle. Placement of the copper T380 IUD or the 20 microgram levonorgestrel releasing IUD is also considered safe and effective immediately after vaginal or cesarean delivery within 10 minutes of placental separation, although the risk of expulsion is considerably higher than if insertion is delayed for 6 weeks. Some prefer to delay for 6 weeks because the expulsion rate, if done immediately postpartum, is higher. The prescribing information for both types of levonorgestrel releasing IUD advises a waiting period of 6 weeks postpartum or following second trimester pregnancy loss. On the other side, IUDs may be placed immediately after completion of spontaneous first trimester abortion when it is not complicated by septic abortion. Of course, it is contraindicated if there is septic abortion. What about the advantages and the disadvantages of IUD? Advantages include it is highly effective, simplicity and the insertion done in few minutes, and it is inexpensive and easy to remove, and has high continuation rate and used for a long time from 3 to 10 years according to the type of IUD, and could be used by the lactating mother and may be the first choice in lactating mother. Non-contraceptive benefits, example for levonorgestrel releasing the IUD, as in cases of treatment of adenomyosis, endometriosis, or patient with heavy menstrual bleeding and dysmenorrhea. What about the disadvantages? The disadvantages include the side effects of IUD, which is bleeding, cramping, and pain, especially with copper IUD during or after insertion, or perforation, pelvic infection, backache, dyspareunia, vaginal discharge, ectopic pregnancy, and progestin-related side effects possible with levonorgestrel releasing IUDs like headache, nausea, breast tenderness, depression, and ovarian cyst. The second disadvantage include it offers no protection against sexually transmitted infection and HIV. Third disadvantage, failure of insertion. Fourth, expulsion of IUD may happen. Fifth, missed threads or missed IUD. Sixth, vasovagal reaction on insertion may happen. This is some examples of copper IUD and hormonal IUD. As you see here, this is a copper IUD available since 1988, while the hormonal IUD as Mirena available since 2001. Skyla developed in 2013, Lilita developed in 2015, Kilina developed in 2016. Mirena and the Kilina used for 5 years, while Skyla and Lilita used for 3 years, while copper IUD as Baragar used for 10 years, and this is some possible side effects as we mentioned before. What about the contraindication of IUD? Suspected pregnancy, sexually transmitted disease, pelvic inflammatory disease, post-septic abortion, beriberi sepsis, malignant trophoblastic disease, copper allergy, abnormal uterine anatomy, distorted anatomy, either congenital due to congenital septum or bicarnate uterus or any other anomalies, or due to uterine fibroid, unexplained vaginal bleeding, cervical cancer, previous ectopic pregnancy. How to prepare your patient? The physician should discuss with the patient the risks and benefits of IUD and, if necessary, other forms of contraception. You can give the patient non-steroidal anti-inflammatory drugs like ibuprofen 600 mg 1 hour before insertion to alleviate discomfort. The physician should instruct the patient about how to locate the IUD threads. It is necessary for the woman to locate the threads to verify the position of IUD after each menstruation if she can do it properly. This is the equipment needs for IUD insertion, and as you see the casco speculum, this one is disposable, this one is sterile one, and you need ring forceps, and you need long scissor, and you need piece of cotton and the antiseptic betadine for cleaning of the cervix before insertion. And this is the IUD, as you see it, copper IUD. And you need, of course, sterile gloves and sterile tray for the procedure. All these are needed, and of course you need also to hold the anterior lip of the cervix with valcellum or cervical tenaculum. How to insert it? We will take an example for copper T 380 ID by using withdrawal methods. This is the package. It is sterile inside. Of course, you open it first, then wear sterile gloves and insert the two transverse arm inside the tube. First step is to insert the casque speculum, then clean the cervix, then measure the length of the uterine cavity with using uterine sound, then measure the length in the tube and use the plunger at the level of the length measure and insert two transverse arms inside the tube. Then begin to insert the tube inside the uterine cavity. The first resistance will meet you at the internal os. The second resistance will be the fundus. Little bit withdraw. Then you will do a withdrawal method. Withdrawal method means what? You inserted the plunger inside the tube, just touching the end of the vertical arm of the copper T. By one hand you fix the plunger and by the other hand you withdraw the tube to outside. When you withdraw the tube outside, the transverse arm will be released like that. Then you remove the plunger and then you remove the tube. This is called withdrawal method for insertion of copper T 380. Another example for insertion of levonorgestrel releasing ID as Imbrina, for example. As before, you insert the speculum, clean the cervix with antiseptic solution, hold the anterior lip of the cervix with valcellum, single tooth or multi-tooth, then insert intrauterine sound. The sound will measure the length of the uterine cavity and know the direction of the uterus. Is it AVF or RVF? This is as before and cover the insertion. Then fix the plunger at the level as you measure the uterine cavity here, and with this slider push it up so the both transverse arm skipped inside the tube. Then begin to insert the tube inside the uterine cavity. Then push the slider to the first mark, first down. The arms will be released. Continue the insertion by pushing the slider again for the second mark. The whole ID will be inserted as in this picture. Then remove the tube. This is the way to insert levonorgestrel releasing intrauterine device. What about if pregnancy happen while IUD in place? First, you should examine the lady, and if the streaks is present, you should extract the streaks immediately. And second, you should exclude the presence of ectopic pregnancy by doing ultrasound. Is very important. But what if the pregnancy is intrauterine and streaks is not visible? You cannot use invasive method like hysteroscopy to remove the ID. So you will keep it inside because the streaks is not visible. We remove the IUD if the streaks is visible to avoid complication and decrease the percentage of occurrence of pregnancy loss or miscarriage. What is the expected complication that may happen if pregnancy in a woman with IUD in place? She is liable more for placental abruption, placenta previa, preterm delivery, low birth weight, chorioamnionitis, and the need for cesarean delivery. How to remove the IUD? This is the equipment needed. You need the speculum, you need ring forceps, okay? Of course, after sterilization by betadine or the cervix, then you hold these reeds using ring forceps and do extraction for it easy like that. But what if you try to withdraw the IUD by through these reeds pulled by the ring forceps and you found the resistance? If you found this resistance, stop, not do anything, and do ultrasound to be sure that the IUD is completely inside the uterus and not partially perforating the uterus. And wait for another set to do hysteroscopic removal of the IUD. Next, sterilization is one of the methods for contraception. It is a permanent method and it can be female sterilization or male sterilization. Female sterilization can be done through laparoscopy by electrocoagulation of the tube or using fallopian ring or ligation and excision of part of the fallopian tube as you see in this picture. This is ligation and cut and excision of part of the tube via laparotomy or laparoscopy, or electrocoagulation and cut via laparoscopy, or insertion of fallopian ring via laparoscopy. So your approach may be laparoscopic, or via hysteroscopy you enter through the cervix to the uterine cavity and reach the tubal lumen, insert coil or do coagulation, which will occlude the lumen of the tube, its opening to the uterine cavity in both sides, or use laparotomy as before, or use postpartum after cesarean section you do tubal ligation and excision, or do mini laparotomy if not after cesarean, if the patient is doing an elective one, she did vaginal delivery and you wanna later on to do tubal ligation, you will do mini laparotomy. Of course, laparoscopic is the best choice and less invasive, followed by hysteroscopy. What about the male sterilization? Male sterilization means vasectomy. We cut the vas, as you see in the picture, and ligate it. Surgical process of cutting the vas difference in order to stop sperm from mixing with semen so that the semen is ejaculated from the penis without sperms. Of course, sterilization is indicated for very, very special women complaining of serious medical illness which interfere with being pregnant, and the pregnancy is considered life-threatening conditions for them, specifically in patients completed their family and above 40. What is the advantage and disadvantage? Advantage, it is a permanent birth control method, immediately effective, not interfere with sexual intercourse, good choice if pregnancy would be a serious health risk, doesn't affect breastfeeding, cost effective in long term. What is the disadvantage? Require surgery, anesthesia, skills, and has some risks associated with surgery, as any surgery, being not reversible, resulting in possible regret, doesn't protect against sexually transmitted infection or HIV. It has some complication like pain for a few days post-operative, and the pelvic congestion later on may happen with associated symptoms like leukorrhea and heavy menstruation. Lastly, wound complication as any operation. Let us go to the barrier methods of birth control. Barrier methods of contraception work by creating a physical barrier between sperm and ova so that fertilization cannot occur. The most common forms of barrier contraception, including a condom, as you see in the picture, either male condom or female condom. This is the male condom and this is the female condom. Diaphragm is this one. Cervical cape is this one. Contraceptive sponge is this one. Also spermicides, a form of chemical contraceptives that work by killing sperm, are often combined with barrier methods of contraception for greater effectiveness. When you join spermicide with vaginal diaphragm, for example, becomes highly effective. And this is all forms of spermicides. You will find foam, gel, suppository. What about the male condom? Male condom are far more common than female condoms. Male condom is a sunshade that is worn over the man's penis during sexual intercourse. The condom collects sperm so that it is not released into vagina. Condoms are made of a variety of material including latex, rubber, plastic, polyurethane, and animal tissue. They are also available in a variety of sizes, colors, style, and thickness. They may be dry, lubricated, or treated with spermicide. Of course, male condom is important as a protective from sexually transmitted disease and HIV. And this is one of its advantages. Also, it reduces the risk of sexually transmitted diseases that are transmitted by genital fluids like chlamydia, gonorrhea, and trichomoniasis. Reduced risk of genital ulcer disease such as syphilis, genital herpes, chancroid, only when infected areas protected. May reduce the risk of genital human papillomavirus infection and the human papillomavirus associated diseases like genital warts and cervical cancer. What about the female condom? As you see in this picture, contain two rings, one closed end and one open end. A cylindrical vaginal pouch made of soft polyurethane with ring at either end. One end is the pouch is open, the other end is closed. This closed end will be toward the cervix. A woman inserts the closed end high up in her vagina over the cervix. The open end remains on the outside of the vagina. The vagina is now lined by the condom. When she has intercourse, the man inserts his penis into the open end of the woman's condom. Once intercourse is over and the man withdraws his penis, the condom containing the semen can now be removed and discarded. Of course, you cannot use both male condom and the female condom at the same situation because friction will happen, leads to disruption or perforation, and the failure of the method. You only use one of them, either male condom, which is more common and more effective, or as success as a contraception, or use female condom. If accepted by both partner, it's okay to use this method, but the disadvantage only is that it may be perforated and leakage of some sperms may happen, so failure may happen. Also may interfere with the sensation of during sexual intercourse and may not be accepted by some partners. Let us go to the next, which is contraceptive sponge, which is donut-shaped ring of polyurethane foam and is impregnated with spermicide and oxynol 9. This chemical confers most of contraceptive efficacy of this product. And before intercourse, a woman inserts a sponge high into the vagina. The spermicidal sponge should then act as a barrier in order to prevent sperm from reaching the cervix. The sponge must remain in the vagina for at least 6 hours following intercourse in order to provide optimum contraception. What about the diaphragm, which is soft, flexible, dome-shaped latex cup, which is inserted into vagina prior to intercourse, and the rim of the cup contains a coil spring of metal which serves to hold it in place. The diaphragm blocks access to the cervix so that sperm cannot pass. The diaphragm must be covered on both sides and especially around its rim with the spermicidal jelly, cream, or foam in order to form a tight seal with the vaginal wall, as you see here, a tight seal with spermicide with the vaginal wall. The diaphragm must be left in place for at least 6 to 8 hours following intercourse. What about the cervical cap, which is small, about 1 to half inch or about 3 centimeter? Simple shaped dome made of latex or silicone rubber. It is much smaller than the diaphragm, as you see in the picture, which fits directly over the cervix. One small application of the spermicide is placed inside the cap at the time of insertion. It can be inserted as long as 8 hours prior to intercourse and can be allowed to remain in place for up to 48 hours. What about the natural birth control? Examples of natural methods of birth control include the calendarism method, so you avoid the most fertile period, which is expected between day 11 to day 19, for example, or use basal body temperature method to detect the time of ovulation by the raise of the body temperature, or use cervical mucus examination. We know that under effect of estrogen, the cervical mucus is fluidy. When it starts to become more viscid, this is indicating ovulation. So you avoid the intercourse in these days. Or use coitus interruptus by ejaculation outside the introitus. Or use breastfeeding, especially in the first 6 months when breastfeeding is regular. What is the advantages? Being cost-saving, lack of prescription or healthcare visits, avoidance of medication or procedures. What is the disadvantage? They can be difficult to use correctly, and that sexual intercourse must be avoided at certain times of the month. also the failure rate, which is higher than other methods of contraception. It is the least effective of them, with more than 18 per 100 women per year. This is the end of my lecture. Thank you. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University.